summarize your experience today. Thank you to Joanne Lee, Senior Project Director. She'll help us to facilitate the Q&A portion of today's webinar. And also thank you to Becky Snyderman, who is our Project and Events Coordinator and is serving as our chat manager for this webinar, as well as providing Zoom platform and logistical support. One moment. There we go. All right. So before moving into today's topic, let's review some logistical items intended to create an atmosphere that supports group learning and engagement. The chat box is a space where we can share and learn with each other. Please use it to add comments, reactions, and links to any related resources that you think could be helpful to others. Be sure that the setting in your chat box is to everyone, unless you need one-on-one logistical support. Then direct your chat to Becky Snyderman. Participant chats can be a great way to gauge how the webinar content is resonating. However, if you find the discussion in the chat to be distracting, you can close it and disable the chat notifications in Zoom. Another Zoom menu item I'd like to point out is the Q&A box, and this is where we would like for you to put any questions you have for presenters here, not chat. That helps us to better manage and address your questions. We have made closed captions in English available in this webinar, so feel free to turn on that feature if it's helpful to you. And yes, this webinar is being recorded, and you'll receive the recording and the slides from today's webinar. In fact, by joining today, you'll be the first to receive them before we disseminate them publicly and post them on our website. Our Socially Connected Communities Network, there are 4 components to it, each one enabling you to opt in based on your individual and community needs. So today you're joining a webinar. These webinars are hosted bi-monthly and they are intended for learning and gaining knowledge. Our next webinar is September 11th, so you'll see that shortly, but please mark your calendars to join us. Immediately following each webinar, we host discussion groups, and that enables you to talk with each other and with our webinar guests to go deeper on the topic at hand. We're going to chat the link out to join today's discussion group at the end of the webinar. And then each webinar and discussion group following those, we create resource guides for you to continue learning, and those will be accessible to you. Again, you'll be the first to receive those. And then finally, we have peer connection sessions tailored for networking across affinity areas, such as priority populations or specific implementation strategies. Our peer connection session for community coalitions was delayed, but we do aim to host that later this fall, so be on the lookout for that. And then contact us to let us know if you have ideas for future peer connection sessions that we can host. Okay, actually, we were going to we'd like to know where you are on your journey. And so to get a sense of that, we want to do a quick poll. Are we able to launch that poll now?
It looks like we don't have it at the moment, Risa, but you're welcome to ask people to chat those responses.
All right, thank you. So where are you in your socially connected journey? Are you just beginning to learn and discuss this issue? Are you ready to move to implementing strategies in your community? Are you already implementing social connection strategies and looking to strengthen or deepen your work? Or have you been implementing them and you're looking to go deeper? So you're just beginning, you're ready to implement, you're already implementing, or you are down the road on the journey. So if you don't mind sharing your responses with us in chat, that would be helpful. As you do that, we are excited to move right on into our topic, which is resilient, socially connected communities. Resilient communities embrace the vital conditions for health and well-being in times of immediate crisis, as well as through sustainable connections and coordination across individuals and organizations in communities. Intentional strategies to strengthen social connections and networks enable communities to remain resilient through natural disasters, historic and repeated traumas and inequities. And in this session, we'll explore sustainable approaches toward community resilience and social connection. I'm very thrilled to introduce you to our two guest presenters today, who I've been getting to know over the last couple of months and very much respect the work that they're doing. Erin McDonald is a senior advisor in the Office of the Assistant Secretary of Health, where she leads government efforts, including the HHS Food is Medicine Initiative and People and Places Thriving. I love that phrase. Before stepping into this role, she was the regional administrator for the Administration for Children and Families, and in the Mid-Atlantic, where she led strategic initiatives to promote the economic of well-being for children and families. We also have Kate Dupont Phillips, who is the inaugural executive director of Healthy Communities by the Healthy Communities Delaware. I almost said our own name. A network of communities and investors working together to improve health and well-being and equity across Delaware. She facilitates investment and community-led efforts to improve the vital conditions for well-being, social determinants of health, with the goal of all people and places thriving, no exceptions. Welcome, Erin and Kate. We are very happy to have you here and very much looking forward to this discussion. We're going to start out with Erin, who is going to set the stage for sort of high-level work that's been happening at the federal government. Erin, can you share with us the way that you define this topic of community resilience?
Absolutely. Hi, Risa. Nice to see everyone. Hi, Kate. This is such a pleasure. This is such an important conversation. And I know that we're looking at it from a lot of different dimensions, and I'm going to share, but I loved the ask of really thinking about it from the relationship to socially connected communities and how that's a through line for all of the work that we're looking to build and to do. So this was such a great question to get, because we have in the federal landscape, importantly, there's a very significant and incredible body of thought partners across 47 different federal departments and agencies that really saw the need as a part of our collaborative work to make sure that we were all really using the same language and having a definitional quality that was going to help us not only speak into the same concept around what do we mean about resilience and how do we come to that work, but also express how does that relate to our respective mission space, right? That there's a relationship to resilience in a context of heightened need or an urgent response that you're building a response to or from an experience of, but there's also incredible opportunities that I think we're all increasingly aware of and attuned to really helping to build about how do we build really proactively resilient and vibrant communities, and how does that help us frame the ways that we relate? So the work that we did in the federal government through People and Places Thriving was to really look at qualities of resilience definitions from an analytic point of view. So this slide is representative of what we were really discerning, having looked across the federal government, where there's actually a number of definitions of resilience from very different contexts, from climate to emergency response to a broader frame, and really looked at what those qualities were that was helping to evidence the fact that there are key elements that are a part of that frame in all cases. We really took that, I think we can go to the next slide. We really took that and wanted to make sure that that was then a model that we were looking at from a context of building on and really reaffirming what federal definitions had offered and what we were aligning to in our collaborative work that was inclusive of a broader set of perspectives around the relationship of resilience to thriving. So our definition, our working definition, is what you see here on the screen. That definition, really importantly, is driven by principles. And so that it means that we are speaking the same language, but what do we want to see out of that definition and the work that relates to it? That was really important for us to outline and to really make sure that we were consistently aligned. These principles are very much aligned, and we've been working in close partnership with colleagues at FEMA that are going to be soon releasing the National Resilience Guidance, to colleagues in the National Security Council that are doing, a lot of really important big tent, big picture framing around national resilience. So these are resonant across very different groups and really aligned to what we're talking about in the work that all of you are doing.
That's amazing. I love these principles that are here and the broader definition that you have shared. How does community resilience intersect then with socially connected communities?
Yeah, such a great question. So we have driven our work through the frame of the vital conditions for health and well-being, and now the frame of health, well-being, and justice in many different contexts, and how the framework is really helping us understand the power of really looking at the capabilities of systems and resources that we are related to, that are expressed through the relationship or framework of the vital conditions, and how that can really help us understand what brings us together. What are those assets that we need to really be attentive to, that we can really use in concert, and how does that help our work shift the frame of the number or the proportion of folks in communities that are thriving, to grow that proportion relative to those that self-identify as struggling or suffering, and that experience that they're having within the context of their lives and community, and that we really look to understand how those vital conditions are really pointing us to those qualities of engagement and community, coming together in our economic and our social and civic lives, and really looking at how those resources are then helping us to drive our investments that can reach towards greater thriving. So we really look at that in terms of the definition and how we're focusing that relationship to the work that we are doing in the context of this interagency effort that is very related to a number of incredible efforts that are in their own right happening across the federal landscape that are driving on a number of these different vital conditions. And part of that, in that context, was really understanding how we are seeing the vital conditions as a framework really support what socially connected communities look like. And so in our relationship to that work and in our own collaborative partnership across the federal government. Oh, actually, if we could go back, thank you. There are a couple tenets that I wanted to call out in this work that we have seen consistently, that the framework and really looking at that center point in the framework that we saw around belonging and civic muscle as a very clear way that we invest in communities and resources, and how it relates to those other vital conditions, that really making that choice collectively and individually as in the federal landscape helps us build a bigger tent around how we relate to the work of thriving and helping create generative, socially connected communities, to really identify how we're supporting very clear action that has a shared vision around thriving, and how we have resources that relate to the ability to have communities really self-actualize what that is. That we are asset driven in our approach to understanding and engaging with communities versus deficit or vulnerability driven. And that's important in both our expression and how communities also experience themselves in the ways that we articulate those needs and opportunities. That we're really looking at systems investments and how that can really help drive more collaborative engagement, and that helps create build greater connection within communities. And that we are really supporting integration across systems that are transparent and really have shared value around access. So we have seen this in the work that we are doing, and that's also something that we are working to really embed in the ways that the framework is being actualized in partnership with communities.
I love this, Erin. This is so amazing when we really think about getting to the heart of what drives a lot of the work that's going on in very many different agencies and different sectors, but being able to see how belonging and civic muscle does create that big tent, does focus on what we're after and not what we're trying to prevent, and more it's super encouraging. I would love for you to say a little bit more. I'm just advancing this for the full slide, but a little bit more about how the plan lays out this approach that you're talking about to cooperatively strengthen these vital conditions and improve community resilience and well-being.
Yeah, I appreciate that question. And I love this slide because I think it's an expression of what we're all after, and have appreciated that this has been shared thought partnership with our colleagues at Rethink Health and the Ripple Foundation, and colleagues like Kate who are doing this work in Delaware. And it has started really important with some philosophical shifts. And I think we're all present to how we work in very complex systems that are important in how they operate, and we respect and value that. And also just making sure that we're attentive to how we're engaging in the ways that we're finding each other and the work that we're being, asked to and called to do in partnership with community. And so this is an expression of our, that traditional transactional kind of way of thinking that we have interventions, we have tools, we're going to bring those to really address those needs and help support communities. There's specific action that's called for. And we oftentimes as systems and people make assumptions that those are very clearly going to track to these outcomes that we want, right? Some called out here around what are some of those qualities that we want to improve or support around. And oftentimes we know that relationship to that outcome is not translating because of the way that we're starting with our tools to apply to what must be the outcome. And so the value and the beauty of, I think, the opportunity of how we're using the vital conditions and applying it to really thinking about building socially connected communities and vibrant communities that are really thinking about systems of care and how we're identifying those relationships to resources. It's the way that it flows is actually backwards. So we start with the North Star. We start with really understanding what are those qualities of what we want for people and places, and what do we collectively want? And how do we have a shared stewardship relationship to really discerning and identifying how we build that North Star or that vision? And then we apply and say, what are our actions and mindset? What tools do we have to get there? Versus assuming that the ones that we're bringing to the table are immediately the ones that can provoke that outcome. So it starts with that generative opportunity versus seeking, the same kind of path. So that's really been a powerful opportunity in the work that we're doing. And the way that has importantly, that prior slide has been so important in this work is that this work from the very outset has been cross-sectional. It has also been cross-sector in our relationship. So it started within community through the work of the Springboard and the incredible catalytic partners that came around a table to ask themselves the same question of how do we as civil sector partners and philanthropic partners, how do we support communities to thrive? And their work really was in complement with the work that we have pursued as colleagues within the federal family across that wide range of federal departments. And really importantly, as we'll hear from Kate, it is happening and alive and really driving the conversation in states where the deep work is happening with communities. And it has really helped us really look at those aligned opportunities in the federal landscape and some incredible and powerful opportunities and advancements around a number of different topics that relate to the ways that I think we're collectively really looking at how do we bring resources to many of these different areas of focus. This is an expression of just all of the federal colleagues that are around the table, and we're still growing. So we have 47 on the slide. We're actually at 49 federal departments and agencies. That's up today. So folks continue to really find relationship to this thinking and to the opportunities that are really identified as recommendations and objective actions that we can take within the federal government to really help align the ways that we are leveraging our resources to help support, and build more thriving communities, and to really look at how we're helping to create communities become more socially connected and generative places in the ways and shapes that we have relationship to that work. And you can see the wide range of the partners and the different dimensions of those different departments and agencies that have very different and equally important mission space to the ways that we relate to community.
I love this, Erin. I mean, that's exactly what I was thinking, looking at it. People can see themselves here no matter where they are in their journey of life or, stage of week or whatever it may be. This is so beautiful. It's multidimensional and exactly as you said, representing our lives.
So the thing that, to your point, Risa, the thing that keeps coming up in that mix is that this has really created an opportunity for federal colleagues and external partners and many different places to really to carry a philosophical shift in how we engage and are in partnership. And it's asking us to really look at a centering point, how do we align and harmonize action and resources from the very different relationships to those resources and actions that we have, and doing that through a frame of a shared ethos around socially connected communities, of thriving communities, of places that are generative and vibrant, and how do we use our resources to really point to that collectively, creating a shared goalpost and how we get there. To your earlier point about the range of, in the moments of where people relate on that slide of the federal family, I love when we have federal interagency meetings and the number of colleagues from very different departments, they say, but I have a relationship to that, and I have a relationship, resources that help support that. Like there's an honoring and a connection around the ways that we're working to support versus just the lanes that are sometimes expressed, but there's such a range of ways that federal departments support and honor the ways that they're really creating connection for communities, and that we're shifting lexicon and how we engage, importantly, and really building community centered and community led responses.
It's beautiful.
And this is the ways that one of the things that we did was really step back, and there's thousands of federal resources, right? From technical assistance to data, to funding, to policy. And many of those can become quite expansive. And so we really took a step back and said, what are the levers that we have to really help actualize this? And that was important to call out. So these are the kind of the key centering federal levers that are, that work differently across different federal departments. But the visual in the slide really expresses the fact that there are federal departments that have levers in a relationship to such a wide dynamic number of actions or resources that connect across those different, very diverse those vital conditions in how they operate. And that's powerful to see that we all have connection into that, and that there's ways to use those levers to be able to engage and support a number of those different opportunities within those vital condition spaces. And this is an expression of we took it from the perspective of why those levers are important in every single action that has been named within the federal plan, that there is a treatment, there's a space for conversation where it is not only named as a leading point around an opportunity or an action or a recommendation, but that it's qualified in terms of what is the literature help us understand why that's important. What are starting points for federal action and for federal partners to really look at? There are incredible ways that we are working in these spaces already. And then how does it relate to those federal partners that are contributing and will contribute to any of those starting points to really help create action around those ideas? The thing that I've really been excited about is not only the work in the federal space, but as Kate, I know will share in their work in Delaware, that states like Delaware have taken this and made it their own, where they connect to that and where they take it further and make it better and really kind of think about how that insight or that expression of an opportunity really relates to something that they're seeing as a value within their communities and the work that they're doing. And I wanted to share this as a close. Just what are we seeing that's making a difference in the ways that we're, operating to the question of, how does the federal plan help us really look at this quality of socially connected communities and thinking about vibrant and thriving communities, that we're really seeing a real uptake of these ideas, a real honoring and intentionality of how we're driving relationships and really building that North Star. A number of efforts within the federal landscape are really pointing in directions that really speak to that, especially around resilience and around connection, and around equity, and that there's a frame shift to really think about not just what are we doing now, but what's the purpose and intentionality of what that will help us build in the future, and having a long-term point of view about the ways and kind of opportunities that we're aligning to in terms of the steps that are moving forward, that we're really looking at interagency opportunities that are really dynamic, and we're seeing a lot of that incredible work. I know that's a real hotbed of thinking within the work that I'm also doing for Food is Medicine, that it's a wide range of partners from HHS to the VA to the National Endowment of the Arts to Commerce to HUD, that there's a relationship of those ways that we engage with communities and support them in the context of that perspective of food is medicine as a case in point. And that we're really expanding the ways that we're learning and thinking about what are measures that have meaning to express the ways that we're thinking about this work.
This is incredible, Erin. It's so encouraging to kind of see that this has happened now at the federal government level, and agencies, almost 50 agencies coming together, seeing this sort of common North Star vision, building relationships with each other, taking themselves out of isolated lanes and seeing the collective complex issues that are life, but in a very elegant way with this framework that is being implemented and with a North Star of belonging. That is just so encouraging to see that level of work and to know that it's not only happening at the federal level, but also that it's getting implemented at state levels and local levels. And we know that as that starts to pick up steam and there's a lot of learning that can happen, this will just continue to deepen and scale. And that's super exciting. So thank you for sharing that. Now I'd love to welcome Kate back, and we'll move to the next slide. And if you could share with us just a little bit about how this work is in Delaware is aligning with what we heard from Erin and the federal plan's approach, that would be amazing.
Sure, Risa, will do. It's always great to be invited to these kinds of things. And I saw a couple of my national colleagues who also use this vital conditions framework. So please chime in the chat if you're so inclined as to how you find it valuable as well. And I saw some Delaware colleagues as well. So would love to hear from you all. So Erin shared a lot about this great federal plan, and we've been using it, found it incredibly useful actually over the last few years in Delaware. So I'll share a couple different ways in which we are using it and how you might also find it valuable. So Erin showed you the vital conditions framework, which is right here. These are all of the places, the things about our communities that are important for our well-being and thriving. So it includes a variety of different things: a thriving natural world, basic needs for health and safety, humane housing, meaningful work and wealth, lifelong learning, reliable transportation. And as Erin really centered in, belonging and civic muscle is in the middle, right? It's the thing that when we improve can help to drive all of the other vital conditions forward. And obviously creating socially connected communities is a big part of that. So in Delaware, we are using the vital conditions framework in one way for our state health needs assessment and state health improvement plan. So state public health departments need to complete this process every 5 years as a requirement of accreditation. Traditionally, many state health assessments and improvement plans have focused on disease states. So what do we think we're going to do about obesity? What do we think we're going to do about diabetes, heart disease, infant mortality, et cetera? So now we're really trying to shift our thinking, what we call upstream, right? So what are the root causes of a lot of these diseases that we're trying to improve? And the vital conditions framework is really an evolution of what used to be the social determinants of health, right? It's a similar idea. What are all of the factors that influence health outcomes? So it's been really useful for us to use this framework in helping to assist and helping people understand what these upstream factors are. So when we talked about the state health needs assessment, we approached it in two different ways. One, understanding what the disease state priorities are. Of course, this is health outcomes specifically are still important. And so through a number of different data collection and prioritization processes, Delaware stakeholders identified the following disease state priorities: chronic disease, maternal infant health, specifically infant mortality and maternal mortality, mental health, substance use, gun violence, many of which may be familiar to many of you and may be similar challenges in your communities. So we also had the opportunity to think about, okay, so what are some of the upstream factors in our communities, in policies and systems that are influencing a lot of these disease states? And some of the ones that were prioritized in Delaware were an extreme need for housing, especially affordable housing, basic needs for health and safety. Can people have access to healthy foods? Do they have a grocery store? Are foods affordable? Can they access the primary care healthcare provider? Often not. Reliable transportation. This is a very important medium to enable all of these other vital conditions as well. You've got to have reliable transportation to get to a job, to get to school, to get to anything else you want to do. And lifelong learning, specifically in Delaware, early childhood education, and that would propel people to thriving opportunities throughout their lives. Next slide. So after we went through that process for the state health assessment itself, we had to start thinking about how are we going to create a state health improvement plan? What are we going to do to address the challenges that we've noted that we have in Delaware, both the disease states and the vital conditions. So we are using this, leaning in real heavily to this concept we call multi-solvers, which is the idea that if you can focus on strategies, investing your time and your resources in a few things that have broad impacts across multiple vital conditions. So you'll see a couple of these examples. These are from the federal plan that Erin referenced. Increasing access to green and blue spaces, like that's water and parks and recreation, has an impact and primarily is focused in the thriving natural world, but also can improve basic needs for health and safety, humane housing, lifelong learning, reliable transportation, et cetera. So it's really focused on the idea of thinking about the interconnectedness among vital conditions and not thinking in silos about one thing and how it doesn't relate to another. So this was an advancement in thinking that we were really excited about and think it's going to have some broad impacts and really help us focus priorities so that we can address not just disease states. So yes, do we need to help people with the diabetes prevention program? Yes, but also let's look at all of the root causes of these challenges in our communities and really put some focused collaborative effort around a few things. So that's kind of how we're taking this approach related to the State Health Improvement Plan. So if I think about how many of you might be doing some sort of a health assessment, these can be with states, county, local, territorial, hospital systems, which I previously worked for, have to do health assessments on a regular basis. You may find it useful to use the vital conditions framework as a tool for your work. It really does help us think about all of the components and communities that can influence health. And again, thinking about multi-solving as a lens for prioritizing strategies. There's lots of challenges and lots of things that we can do about individual challenges, but try to think about what interventions, I don't love that word, but what strategies, what interventions can have lots of positive impacts rather than thinking about one thing at a time. And I think social connectedness, like many other things, can be built into health assessments. Really, I think the key here is intentionality. So as you're thinking about social connectedness as an option, think about each of the vital conditions and how each of them could facilitate social connectedness. What do you have going on now related to reliable transportation that you could tweak to improve opportunities for social connection? So if you thought about each of the vital conditions in that way, that I think is a real opportunity to be really comprehensive and thoughtful and maybe come up with some ideas that you might not have thought of related to social connectedness.
That's wonderful, Kate. Yeah. And I love the, thinking about sort of social cross cuts. It's not just in belonging and civic muscle, but we can think about how the work that we're doing in each of these vital conditions, as you said, with that lens on, can be tweaked for that impact as well. We'd love to hear how this is so important, and we also know there's a lot of disparities and injustices and ways that things are not as accessible. We want to talk about that too. So could you share with us, because I know you are, how you are ensuring that the work in Delaware is focused on communities that are facing the greatest inequities and have the most to gain?
Sure. So I mentioned one example, and our whole state health improvement plan and needs assessment process was focused on equity. So that was one really important systems change that we also made, that was a tenet of that report. But another example of how we're using the vital conditions in Delaware and how we're increasing investment in communities experiencing disparities is through Healthy Communities Delaware. So Healthy Communities Delaware is it's sort of like a public-private partnership. It's managed as a collaboration among the Delaware Division of Public Health, the Delaware Community Foundation, and the University of Delaware Partnership for Healthy Communities. So it's basically a network of investor and community-based organizational partners who work together to improve health, well-being, and equity across the state. We all are aiming for healthy, safe, and vibrant communities where all people are thriving, no exceptions. So the way in which Healthy Communities Delaware was created about 5 years ago, the way in which we go about investing in communities and developing partnerships initiated with first looking at a geographical map of where census tract wise the worst disparities are. So we did that using two different data sources, the CDC's Social Vulnerability Index, as well as the Area Deprivation Index, which was originally developed by HRSA. And so we identified sort of what are the communities, the eligible communities, those with the highest disparities, and we issued some requests for proposals and engaged a number of geographic communities and community-based partners in our work. One of the important things I think to note here is that one of the different things about our model is that we intend to invest in communities over the long term. It takes a long time to make meaningful change in community, especially when you want to work with historically underserved communities, with those that might not have a lot of capacity and infrastructure. So we invest in and partner with these communities over the long term. We started with a few in 2020. We expanded that group. We continued working with the original group and added more. And our intention is to continue those partnerships over 10 to 20 years. So here's just an example of some of the Healthy Communities Delaware partners in a geography across our state. You'll be surprised to know that Delaware does only have 3 counties. And so, and is about 2 hours long from top to bottom. So makes it quite accessible for us to visit everyone. But you'll see a map, and a lot of these communities are the ones that we work with, and also how those would potentially overlay with the vulnerability index or area deprivation index if you looked at the maps together. So all of our work, really, we're sort of an enabler. We're an intermediary between the systems and communities. So we try to support communities in building the capacity that they want to make improvements on the vital conditions that they've prioritized. So one of the communities might be working on improving transportation, one might be working on housing, one on workforce development, or lots of different things. And those might change from year to year, but that's the kind of support that we provide to our community-based partners. Each of these in bold is like a geographical area, and underneath are the organizational partners with whom we work. So we put funding through nonprofit partners on the ground who often facilitate that collaboration and do the meaningful work on the ground to improve vital conditions. So I wanted to share a couple examples and in a way of thinking about this. So thinking about building resilience, we feel like our model is one way to do that, and that we actually are growing resilience of communities by long-term partnership with community-based organizations. I think one of the interesting things that arose out of COVID was that healthcare systems, public health, et cetera, realized very quickly, oh no, how do we get to the people? We're not trusted messengers at the state level, and tried very quickly to collaborate with community level partners. In Delaware, we were so fortunate to have just created the Healthy Communities Delaware infrastructure. So we were able to really quickly use that in the time of COVID. So it was really valuable infrastructure. But I think the point is we need to maintain those collaborations. We need to maintain that infrastructure, and that supporting and working with community-based organizations who have a direct line to residents is critically important, and really should be thought about as part of the public health infrastructure in general. So a lot of our partners, as I mentioned, are working on a number of different things, parks and green space, affordable housing, supporting civic associations in neighborhoods and events, youth activities. So I mentioned, I think that we all have the opportunity to think about what we want to focus on as multi-solvers. So if you're already doing these things, think about how you can use that park to increase social connectedness. Can you have events there? How do you help people come together, meet one another, et cetera? How can you do that in affordable housing, whether you already have it or whether you're planning it? How might you create space if you're in the design process to support social connectedness? I'm going to look at the bottom, and you guys will have this link, but I recently read an article that I really liked and saw this video is great. And it's an example, I think it was from Denmark, about co-housing and how communities are designed with the small houses with a central area of green space, and the whole design of the community is really meant to facilitate social connection. So that people walk out their doors, they see each other as they're walking their dogs and their kids are playing, they're in the garden, they all have that built-in, truly built-in opportunity for social connection. The cars are on the outskirts. And so that's just a really interesting example of a very intentional design that can facilitate social connectedness. And I just wanted to make one more point, is that, process in our work is as important as the end product. So we have to always put the people in communities first. They should be the primary solution drivers, and really helping us understand what they think are good opportunities to both improve vital conditions, increase social connectedness, et cetera. What would work best for them?
Thank you, Kate. That's amazing. Yeah, and we know that's a virtuous cycle, right? The more you engage people in meaningful ways where you're creating that inclusive, welcoming environment, the more they want to be engaged, the more trust that is built, and the more connections that there are in a community. And I also love that you talked about long-term investing, not just being 3 to 5 years. You're talking 10 to 20 years working in these communities. That makes so much sense. It's unfortunately rare, but also super necessary if we're really going to address these complex issues. Thank you, Erin and Kate. We have gone through some incredible information. It is now time to hear from our audience. I will turn it over to Joanne Lee, who will help us facilitate the Q&A.
Wonderful. Well, thanks both to Kate and Erin, as you all have really gotten folks thinking, which is exactly what we want, about this topic of resilience, its connection to social connection, and how it might play out in their own communities. So we have several questions queued up. We've got about 10 minutes. Some of the questions are for you individually. Some I would love to hear both of your perspectives about, and I'm sure our audience will too. But I'm going to start with Erin. So definitely hearing about how there's cross-departmental, cross-sector coordination, engagement on the federal plan has really gotten folks excited. And one of the participants noted, it seems like there's really great alignment now. Was there a time where there wasn't? And what specific actions helped create this alignment and the shared framework?
That's a great question. Yeah, I think we're all humans in big systems and organizations that take, we're all ready to change and we take time to change, right? Those are always important kind of tensions that we hold. So I think a couple of things in this. It's I think that there's absolutely, it's a really great insight that I'm sharing, where we are, and there's been a journey to date. There's a journey now. There's going to be continued work that we're moving towards. And so by no way am I expressing that we've reached that kind of pinnacle of how we want to do the work or implement the work or create more partnerships in that frame. Thinking about where we are now and where we look back, and where we've gotten. There's absolutely been times where, it's actually been more so that the biggest opportunities have been finding the right champions in departments and agencies. And I think that's the thing that stands out to me consistently in the work since the very outset, before I, even joined, the ways that we've advanced the work and the incredible team that was leading that work and that we've continued to build, is that finding the folks that were ready to think in this way, and finding the folks that are champions that really see those connections and want to work to build, right? That has truly been a very clear learning about how we drive that connection. And I think the really key thing in that also was the frame that in every conversation that we had with across departments, inviting folks into the frame, is also to say that we are not here to ask you to do more work. We're not here to ask you to shift your focus from really important, really pressing, complex things that you're working on, but how can we support you to do the work you're working to do by working collaboratively in this way, by thinking about what other resources might be helpful in generating and creating more dynamic opportunities to advance what you're doing. That's easier said than done, but that really resonates. And I think having that framework of the vital conditions truly has been transformative, because as I was, even anecdotally offering, that folks see themselves in parts of that relationship. When EPA, environmental protection says, but I'm in the health mission space. That's where I hang out, not just thriving natural world, right? I have relationship to that. I have relationship to helping to build communities. Like, that creates generative opportunities to find each other as a very complex federal family, and how we can then, work to really align our efforts. So I think those were all really important. And really, really having those important conversations where we were co-building. Co-building has been so important to this work. Everything that you have seen come out from the federal family on this effort has truly been co-authored, been co-created by those subject matter experts across federal departments that are vested and have deep knowledge and are really advancing the thinking together.
Great. So key takeaways: take a systemic approach, but find your individual champions and engage them in the creation process. Wonderful. So Kate, I'm going to switch to you, because another really great important question was around measurement. How are you tracking success? Thriving is really a long-term thing. So how do you track the impact, maybe in near-term and longer-term ways?
That is a fabulous question. And
We have a
something
really
I think,
insightful audience.
yeah, well, I mean, this is great. And I can tell you that we don't have an easy answer to that. And that's something that I think anybody in this long-term work continues to struggle with. So I'll give you the answer that we have now, which is that we both track short-term outputs. So we ask all of our community partners, for example, we're investing in your work on affordable housing. And specifically that means, let's say, facade improvements or home improvements on X number of houses. So when they give us a report on the work that they have done over the past year, we ask them for numbers, because quite honestly, that's the case that we also have to make to other investors. We have to say, look, here are the numbers of things that have happened. Is that ideal? No, I don't think it's ideal at all. But also, as as the question asker mentioned, it is very hard to understand how to communicate long-term impact. And I think, so we're still trying to tell the story of that. We're still trying to tell the story of the fact that we have to try to manage this tension and both provide short-term outputs. And vignettes, I think, are really meaningful. Sharing stories about how things are happening in communities, how people are acting differently, how they're working together differently, is another great way of sharing progress in a way that's not numbers, but it helps to capture some of the intangibles.
Great, wonderful. So I have a question that just popped up, but I think it's another really important one. I just love that our audience is not afraid to ask the hard questions.
Great.
And this one comes to everybody's mind, and it's about funding, right? And so I think you both have touched on the fact that because the federal plan and Kate, your community's work is really starts with looking at what departments and sectors are already doing and trying to institutionalize some of the strategies into the work that takes care of some of the capacity, maybe not direct funding. But can you both comment on just maybe some additional funding mechanisms to support this kind of multi-solver overall well-being resiliency work?
Yeah. So that's a kind of a broad question. I'll start, and then to say that again, I don't think that I'm not aware that we have not solved this challenge, nor have I heard of any other community that has solved this challenge. It's an ongoing discussion. So when we talk to, and we call them investors, and we call our money that we give with communities, we don't call it grants, we call it investments, because we believe that that's what it is. And also that we're helping people to shift their mindset to think about longer term returns. So I think some of it is language. No, we haven't had any Like anyone who's just jumped on board in terms of investment and said, like, this is the most amazing thing. We have no problem with contributing a huge amount of money. There's lots of hesitation. So I'll tell you, while Healthy Communities Delaware pulls together both public and private funding, we still have to make the case every single year to the investors who come along with us. And we try to just keep saying, okay, well, here's the progress for this year. And then we also try to, at the same time, tell the story about how it's built over the years. So I think that is the challenge and the tension. We haven't solved this challenge, but that's the balance that we try to respond to.
Great. People are loving just that. The change in the use of terms can make a huge difference. Erin, do you have any comments about the funding landscape?
I think that Kate's spot on. I will also say, I mean, we collectively continue to evolve in a very dynamic kind of funding landscape, right? The period, during the pandemic and preceding, from that, it created some very different resources. There's been a number of resources in the federal family that have come out from a number of pieces of legislation that are very dynamic and how they're trying and working to connect dots from funding to technical assistance, with Bill and the IRA. So a couple things just to build on what Kate said. I think the federal plan, all of the recommendations are aligned with what are resources and programs that already exist within, so scope of authority of making changes within federal departments to really align towards the actions that are named and within scope of resource. So how can we be smarter with the resources that we have to point towards these shared goals, right? That we're not foregoing anything that they're intended to act on and support, but what are opportunities to really help think expansively about how they can be used and how can they be used in complement? Not only in the frame of how I think often talk about that braiding and blending in a kind of a frame of reference for how they might be brought together, but how do we look in complement, or who has relationships and partnership resources that could come into the frame? And one of the things that I often I reappreciate all the time is just how many federal departments we might not look at that have expansive resources that are opportunities to bring in terms of partnership and thinking about the complement of what resources and partnership networks exist in that in achieving some of those kind of bigger opportunities.
Yeah, again, it's also building on assets. Yes.
Yeah.
Can I just say one more thing? Because I want to share that I do see some changes in some of the federal funding opportunities that are coming out now. So let me just give you an example. For example, in Delaware, we're looking at a collaborative application for the EPA Community Change Grant. Really great example of how it's more flexible than many applications I've ever seen. It really focuses on both environment and health impacts and workforce. So I actually think it's a perfect example of how there's some incremental movement and how you can really see also that, supported by the Biden administration, the community voice element that is really central to the Vital Conditions Framework and to all of our work is really well represented. And so I think it's an opportunity for us to, in applications to reflect back to the federal government that we appreciate this kind of flexibility that we're using, for example, the Vital Conditions Framework, and that it enables us to think about things holistically. So if I have a community that environment is not their top priority, can we think about workforce and green jobs? Because jobs are their top priority. So it's all about really thinking holistically and having the space in funding applications that enables us to do that as well.
Thank you. So I know we couldn't get to everyone's questions. So luckily we have the post-webinar discussion group, and you're going to hear how you can join that in a minute. But Risa has some additional important pieces of information to share at the end of the webinar. Thank you.
Thank you both. Yes, this is exciting. So we just wanted to let everyone know that our next webinar like this will be September 11th on measuring the impact of socially connected communities efforts, which is apropos since that conversation came up today as well. We're very excited about this, and Becky will be putting the registration link in the chat if you'd like to go ahead and register and mark your calendars now. This will be a great conversation. In addition, we want to make sure that you're staying up to date on all of the future webinars and other socially connected communities resources. This is our website. Becky is chatting out the link now. Just a reminder to watch your email inboxes to receive the recording from today, our slides, the resource guide that gets developed as a result of our webinar and discussion group as well. And you'll be the first to receive them, having joined us today, and then they will be made public next month. To round out, we'd like to just find out from you, how did this resonate with you? We're asking a poll question. Did you gain something of value during today's webinar? We're hoping yes, but we're asking for honesty, so just let us know about that. And then the second follow-up is, please share something specific you gained or what could have made your experience better. So here's an opportunity to give us a little feedback. It helps us to continue to improve this series for you. Very helpful for us to hear from you, and very much appreciate your engagement here. We also invite you to share with us if there are any particular topics that you're learning more about or would like to learn more about. As I mentioned earlier, we are conducting peer affinity sessions, peer connection sessions, and the topics or the thing that is the common theme will be driven by you. So let us know. Let us know what would be helpful. We're going to end the poll now. Thank you so much for participating. And now is the time that many of you have been waiting for. It is when we get to go even deeper on this topic. So we want to keep the momentum going. We're going to put a link to the discussion group in the chat and ask for you to join us there. It's where we're going to engage with each other and with Erin and Kate to learn more about how it's going in your community, questions that you might have. Really, really appreciate you, Kate and Erin, for joining us today and sharing your wisdom and this exciting momentum that's building across the country on vital conditions, belonging and civic engagement, resilient communities, and socially connected communities. So we're very excited about that. We ask you to go ahead and join us. And in the meantime, thank you again, all of you, for signing up and joining. And we ask that you stay connected with us on LinkedIn, through our newsletter, YouTube channel, however it is, send us an email. We love to hear from you. So that concludes today's webinar, and we will see you shortly in the discussion group. Thank you, everyone.